Hello class, in this presentation I will explain how I identified my unknown organism as Bacillus cereus. I'll discuss why identifying unknown bacteria is important, the laboratory tests that were most useful, how the results led to the final identification, and why this organism is significant. This is the microscopic view that I had. This is a similar one. I was having trouble getting a clean picture with my own phone, so I found one online that looked very similar to what I was seeing through the microscope. Correctly identifying unknown microorganisms is an important part of microbiology because in healthcare, identifying bacteria allows providers to diagnose infections and choose the correct treatment. It can also help with food safety, preventing outbreaks, and we can learn how to identify techniques by using multiple tests similar to the way we did with this. The laboratory test I chose to use was the Gram Plus, and then the agar slant characteristics, the litmus milk reaction, lactose, sucrose, H2S production, citrate use, and the gelatin liquefaction. These are the results I had for each of the tests, which is filled out on the information sheet submitted. So why the results indicate Bacillus cereus, and looking at all the results together, Bacillus cereus was the best match, primarily because of the rod positive. That left me with only 2 possibilities. And so I specifically ran tests that would give me results that either leaned towards the Corynebacterium xerosis or the Bacillus cereus. And they all started responding with what we would assume Bacillus cereus would show with. So it had a gram-positive rod. It was catalyst positive. It had rapid gelatin hydrolysis, peptonization, ferments, dextrose, and sucrose. And citrate in its H2S was negative. So I went with the final ID of Bacillus cereus. Other possible interpretations, overall with the chart that we had provided, it wouldn't be any of the other things listed. However, it could be a different form of Bacillus, and there might be further testing that could tell us whether or not that were true, but for our lab experiment, Bacillus cereus was the only one that was coming up with all the tests that I had results for. With medical importance, it's most commonly associated with food poisoning. So Bacillus cereus produces toxins that cause either vomiting or diarrhea, depending on the type of toxin. And it also has heat-resistant endospores, so it can survive cooking and then multiply if food is improperly stored, especially cooked rice, evidently, which I eat a lot of rice, so that was a fun fact. Although food poisoning is usually mild and self-limiting, it can act as an opportunistic pathogen, which I listed as one of the identifying measures of why it's important to understand. And that can cause serious infections in wounds or eyes, or patients who have immunocompromises. So in conclusion, my unknown number 3 identified as Bacillus cereus. Multiple tests were required to identify it, and the important in medicine and food and safety. Together, they create a biochemical profile that matched this organism.